Welcome to my world, where we rise and shine, teaching faith, finance, and the way to align. From digital media to fitness, we're building strong.
Hello and welcome back. Today's session, understanding the different types of anxiety. Anxiety is the body's normal response to stress or danger. It forces you to act. However, for some people, anxiety can become persistent and overwhelming and gets in the way of normal life. Day-to-day life, that is. And anxiety comes in different forms. And today we're going to explore the many forms and symptoms of anxiety. So let's dive in. First up, we have Generalized Anxiety Disorder, or GAD, which is characterized by excessive worry about different aspects of life. It can be from work to study to life in general or relationships. Unlike normal worry, this anxiety is often disproportionate, persistent, and very much different from the reality that one is living at that time. Symptoms include muscle tension, fatigue, always being on edge, and sleep disturbances. People with GAD can often have feelings of dread or unease that doesn't seem to go away even when things are going well in their lives. The second one is panic disorder. Panic disorder often carries things that we commonly call panic attacks. So they are feelings of worry and fear in that moment that result in closing up of the chest and heavy breathing, which we call panic attacks. These types of attacks can happen spontaneously or can be triggered by a particular situation. The symptoms of panic disorder include heavy breathing, chest closing up, rapid heartbeat, dizziness, chest pains, or feelings of loss or dying. A panic attack can feel like a heart attack. It can give you the sense that you are dying. It can give you that fear of losing your life in that moment, making it an emergency that is incredibly frightening to the person experiencing it. The third one is social anxiety disorder. It is characterized by fear of social situations or embarrassment in public. This goes way beyond shyness and can really impact how one carries themselves in society and how they relate to the people at large. The symptoms of social anxiety disorder include fear of public speaking, avoiding social settings, physical symptoms like blushing, and also overthinking previous interactions. One finds themselves in a space where they are overdoing or overthinking on the conversations they've had or the actions they've had, thinking about how they could be corrected or redone if they had the chance to do so. People with a social anxiety disorder often feel like everything they are doing is being put under a microscope, that they're being watched with every action or every word. The fourth one is specific phobias, or any type of phobia that one might have. Phobias are characterized by a deep sense of fear for something. It can be an object, a situation, or a place. The most common phobias include a fear of heights, fear of spiders, fear of dogs, flying, or even needles. Symptoms include immediate anxiety when exposed to a situation or an object that triggers that phobia or fear. Avoidance of object or situation that is feared. Physical symptoms like trembling or nausea. This kind of fear, this kind of anxiety or phobia can be very disturbing to a point that one cannot function properly in everyday life, even if that situation or object that is feared is rarely encountered. The fifth one is obsessive compulsive disorder, or OCD. OCD is often characterized by compulsive behaviors towards situations or things, like how one would perhaps over clean in order to reduce their anxiety. If something is placed in the wrong space or perhaps is 3 degrees to the left instead of to the right, fixing those possible situations in order to create calmness and avoid their anxiety. And even though this is the way many of us see OCD, it can be characterized in many other ways. Symptoms include persistent unwanted thoughts or repetitive behaviors like washing hands, cleaning surfaces, and many others. People with OCD are able to create a cycle of anxiety and relief at the same time, doing actions that relieve their anxiety while at the same time being driven by their fears to redo everything again. The sixth one is post-traumatic stress disorder, or PTSD. This can be experienced by someone who has undergone severe trauma or has witnessed accidents or something out of the usual norm. It is characterized by ongoing emotional distress and intrusive memories. Symptoms of PTSD include flashbacks and nightmares, avoidance of the things that remind you of the trauma you've been through, hypervigilance or feeling constantly on the edge, and emotional numbness or detachment. PTSD can make it difficult to trust others or engage fully in life. The seventh one on the list is separation anxiety disorder. While this disorder or this type of anxiety can be associated with children, it can also happen and occur in adults. It is driven by the fear of being away from loved ones. Its symptoms include extreme distress when separated from loved ones, the fear of harm coming to the person experiencing this disorder, difficulty of being in unfamiliar places or sleeping alone. It can also have physical symptoms like headaches or stomach aches. With separation anxiety, the fear of being away from your loved ones drive you into a space where separation is emotionally painful. On number 8, we have health anxiety. This one is characterized by consistent, persistent worry over severe or serious illnesses in the body, even though there is no proof that any of them exist. The symptoms of health anxiety include consistently checking of symptoms of any disease that one thinks they might have, avoiding medical attention due to fear of a diagnosis, consistently seeking reassurance from doctors and loved ones about whatever you feel you might have, and persistently worrying about the disease that you think you're having, even though you have had multiple negative results when tested for it. With health anxiety, every ache, every pain in your body results in a state of fear that makes one consistently worried or fearing that they might be sick. On number 9, we have agoraphobia. This is a fear of being in spaces where escape might be needed. And that escape that is needed in that space might be difficult or impossible, that one feels trapped in that particular space. And this leads to people avoiding public spaces or social settings in general. The symptoms of agoraphobia include the fear of leaving home, avoidance of crowds, elevators, or open spaces, and also panic attacks in the said situations that one is fearing being in. And lastly, dependence on a trusted companion. It can be a friend or a family member. Agoraphobia can make the world feel like a dangerous place, limiting one's ability to be independent and also the ability to experience life in its fullness. If you've made it this far, you might have noticed one or two symptoms that from time to time affect you. And I want you to know that you are not alone. There are many ways that you can be able to deal with your anxiety and also be able to manage it. If you watched the previous video on dealing with anxiety, you would know that there are multiple ways in which you can manage your anxiety. In that video, I speak on 10 ways to manage anxiety. I will link it up with a card here or here and also put up a video here. As you have seen in this video, every type of anxiety presents its own challenges and symptoms, and some of the ways that you can be able to deal with it is to seek professional help. Seeing people like therapists or psychologists can be very good to help you manage and deal with everyday life with whatever type of anxiety that you're living with. Secondly, there is medication to help manage your anxiety. However, it has to be prescribed by a physician. And thirdly, self-care. Regular exercises, eating well, sleeping well getting time to yourself just to be with yourself and analyze yourself and get yourself in a nice, comfortable space. Fourthly, meditation is key. Being mindful is key. Finding the time for meditation, finding the time for things like yoga, things that slow down your breathing and your mind so that you can be able to realign yourself. And lastly, for this video, support networks. There are support groups in various cities and various villages that help people deal with their anxiety. We need to remember that anxiety is complex. Everyone experiences it differently and deals with it differently. And that understanding the type of anxiety you have is the very first step to being able to deal with it effectively and efficiently. Be patient with yourself and remember that help is available, whether through therapy, support groups, or self-help books like affirmations. You can be able to take back the power, regain control, and find peace in your journey. Remember to check out the book, Believe in Your Journey. It can be a very helpful tool in dealing with anxiety, depression, procrastination, and low self-esteem. It also contains affirmations that you can be able to repeat for yourself on a daily basis, on a weekly basis, or however you schedule them as part of your self-care and meditation routine so that you can better be able to handle your anxiety. And if this is the first video that you have seen, there are other videos in the anxiety series. Do make sure to see all of them. They are all different topics on anxiety, which helps us understand anxiety deeper and also learn various ways of dealing with it. I will see you in the next video where we'll be talking about anxiety in the Bible, looking at the different characters that had anxiety and how they dealt with the anxiety. Until next time.
So hit that follow, get ready for the rise. Emma's the teacher and it's no surprise. From faith to finance, it's a full ride. Tune in, it's time to vibe. Emma's the queen, teaching what's real. Faith and finance, that's the deal. She's online, keeping it tight, spreading wisdom day and night. So hit that